Welcome to this video, and I'm going to focus on the UK today because I've been told my videos are getting a bit long, so we'll try and divide them up a bit. Do let me know what you think. But there's useful principles that apply from every country to every country, of course. Lots of interesting, useful things to learn. Now, just put the UK in a bit of context first of all. Globally, cases are increasing. So another 350,000 cases on Friday yesterday, deaths well over 1 million, and of course these are official figures. We know the real number of cases is certainly way higher than this from antibody studies and other studies that have been done. So we're seeing a global increase in cases and indeed deaths as we come into autumn in the Northern Hemisphere. And we had been concerned about this for some time, and this is extending to the UK. Now, this is based on the Office for National Statistics Infection Survey. Now, this is just not the ONS. They work in collaboration with various universities and research things, so it's a very well conducted piece of research. And they're getting nearly 20,000 samples per week. So what they do is they send out the antigen tests. People do the swab to see if they have the virus. They send those back. Now, 20,000 is a small proportion of the entire country, of course, but they send it out in a way which is representative. It's a randomised way of doing it, and they're very good at doing this, and they get accurate figures. So the figures we're getting here very accurately represent the situation in the whole country. This is very well conducted research. You know, when they do opinion polls for elections, for example, they only poll 1,000 people on those, and they're spookily accurate, uncannily accurate over the past few elections. So 20,000 is a really good, seriously good sample size. This is good quality data. So they actually got back 19,933 people in 9,179 households across the country. And this is across the United Kingdom as a whole. So this is good quality data. But the trouble is, of course, it's always a bit behind. So it's from the 25th to the September to the 1st of October. But we can get some good trends from it. And we will be looking at some data from the COVID symptom tracker app shortly, which is up to date to the day. But let's stick with this for now. England, this is just England now, just England on its own. 224,000 people in the community had coronavirus infection that week. Quite a large number, nearly 250,000, but the previous week the number was 116,000. So it's not quite doubled, but it's not far off it. This is a dramatic increase in cases in the past week, derived from good quality data coordinated by the Office for National Statistics. The number of cases has nearly doubled in 1 week. This is unequivocally now a trend. It is a sustained increase. If you want to call that a second wave, do so. It doesn't matter. It's a sustained increase in cases. And it's significant, especially because of the time of the year. We're now heading into autumn. And I must say, I do get a feeling of déjà vu here, because an unpleasant feeling of déjà vu, because we did cover very similar increases back in February, near the start of this pandemic. That's 1 in 240 people in England. That's 17,200 new cases, new infections per day. Now, the highest rate is in older teenagers and young adults. So this is the growth group at the moment. Of course, we know this because we've got thousands of students quarantined all around the country in their halls of residence going back to university, which some may say was a premature move to basically have imprisoned thousands of students at the moment. So it's not surprising that the virus is spreading in their confined environments in which they are now obliged to live. So older teenagers and young adults. Of course, the good thing about this is not transposing through into massively increased hospitalisations as yet. And as well as that, we can pretty safely predict that given that so many of these cases are in older teenagers and young adults, that the degree of hospitalisations over the next few weeks should not take off particularly highly, because it's going to be the vast minority of these people that get sick, although there is a proviso to that we'll see in a minute. North East, North West, Yorkshire and Humber side are the growth areas. Now, when they say northwest in this context, they don't mean where I am in the proper northwest. They mean this area here. I'm actually up here. I live in the proper northwest, just near the Scottish border. But this is what they call the northwest. So here we can see the increase in cases, highest here, but Scotland, north of England generally, Wales, London area, unfortunately, cases now increasing quite steeply in those areas, but particularly the ONS flags up the northeast, northwest Yorkshire, northwest and Yorkshire and the Humber side area. And when we look at a different graph here, also from the government sites, well, I think it speaks for itself, doesn't it? Where we go? Yeah, this is a rapid increase. So that's September there. So this is a rapid increase since the middle of September. Cases of, well, since the start of September really, cases have started going up quite dramatically. Now this was the peak back in the previous peak back in April, March, April, May. But the real numbers back in March, April, May were way higher. Perhaps 200,000 per day. So we're nowhere near where we were back in February, March, April, nowhere near. But the trend is heading in a very worrying direction. It is the trend that we are concerned about. And the proviso I was going to put in the northwest region, there are increasing hospitalisations. And this correlates with the level of increased infections in the over 60s. So the number of increased hospitalisations is not correlated with the overall number of cases. It's correlated with the overall number of increased cases in the over 60s. So this is what we would expect, of course, when this is exactly what we're seeing. Now going back to the COVID symptom tracker app here, day-by-day evolution of the infection across the UK. So we see this rapid increase from, as we said, the middle of September really. These are patients that are symptomatic from the COVID symptom tracker app. Now I'm just going to show you this graphic here because I have mentioned it several times. We'll just let it run through because this is I've often said that there was 200,000 cases per day at the peak, and it's often questioned how I know this, and this is how, because we see that there was over 2 million cases at the peak here back in March, April. So we'll just let this run through once and watch this trend in the UK. So up here we were getting something like 200,000 new cases per day. Dramatically went down with lockdown, of course. And unfortunately this animation stops on the 1st of June. But we do know from other data that these cases are increasing. And as we've said many times, and we'll say it again, the COVID symptom tracker app tends to underestimate because it doesn't pick up the asymptomatics. The big thing about this original data that we looked at from the Office for National Statistics is it does pick up the asymptomatics. It's just picking up positive antigen tests. 20% of those will be completely or virtually completely asymptomatic. So it's the Office for National Statistics data is picking up at least 20% more. But it's important to remember that the Office for National Statistics data is for England and Wales, whereas this COVID symptom tracker app data is for the UK as a whole. And it's a constant source of annoyance to me that different countries collect their data differently. But Wales does come under the England and Wales category, obviously. So Wales, 610 infections in the week. Much smaller population, of course, only 3-point-something million. Previous week it was 6,400. Right, so okay. So what we've seen is in England we've got this dramatic increase. We've gone up to that. From that, virtually doubling of cases in England. But actually in Wales, the rate of increase is well, it's actually a decrease, isn't it? It's actually gone down according to this data, and this data is accurate. So this just shows the regional nature. This is the same all over the states. Any way you look at, really, that it's a very localized picture that we're seeing. Great increases in cases in some areas, actually a decrease in the week in Wales, which of course is encouraging. Northern Ireland, the figure there, Northern Ireland figure is about 1 in 500, similar to Wales, but still increasing. Now Scotland, unfortunately, is in a different data area. So we look at some Scottish data now. Population 5.5 million in Scotland. So we've got to remember, we've always got to think of these things in the context of the population size, because of course the population is greatly less in Scotland. So 5.5 million people in Scotland, an extra 1,246 cases, great increase on Friday, and particularly concerning in Scotland, 16.2% of positive tests. Now, the proportion of tests that come back positive is a really good indicator of how much undiagnosed community transmission is there. So the fact that just over 16% of for every 100 tests that's done in Scotland, 16 of them come back positive. That is a high proportion, indicating a fair level of community spread in Scotland. Therefore, unfortunately, I would expect the number of cases in Scotland to officially increase significantly over the next few weeks, because this indicates to me there's a lot of community transmission going on. And that's really confirmed with this graph from Scotland as well, where we see the increase in cases. Now again, March, April, May, this is a gross underestimate. We know, so that the high numbers we're seeing now, this great increase, the increase, the steepness of that line is completely genuine. The line is genuinely increasing, but we have to remember that the cases here were grossly underdiagnosed. And the other thing that's encouraging is here, this increase is caused more by cases in young adults and late teenagers, whereas a lot of the spread there was in elderly care facilities, and we know the tragic consequences of that. Now this is data from Scotland, but the same applies to all of the UK and pretty well most countries actually. Well, yeah, in every country, the amount of testing now is way much better, so we're picking up a much higher proportion of the cases. And just looking at how this does transpose into hospitalisations. Again, UK is the total. We're seeing, so this is patients admitted to hospital. So we're seeing, on average there, for the past week, 511 people admitted to hospitals in the UK as a whole per day, with COVID-19 specifically. And this data here from the previous peak is accurate. So this data is accurate. So we can see that the hospitalisations are much less, but what we don't like to see is the slope of this line. This slope of this line here is going to be the key thing, how much that is going up. And the number of patients actually in hospital, obviously the numbers are going to be higher. So the past 7 days there was an average of just under 3,000 patients in the UK hospitalised with COVID-19. And again, we know these numbers here were genuine, so we can see the scope of the problem in terms of hospitalisations and the relative problem there to the problem then. We don't want to go back to these bad days, of course. That's why we're worried about the steepness of this line. And if you're interested, you can go and look at this divided by country as well. So no shortage of good quality data, that's for sure, in the UK. Now, deaths in Scotland, unfortunately, another 6 deaths in the 24-hour period. So COVID symptom tracker app there, hospitalisation information there. Click on it and peruse at your leisure. And all the links I put in here I've clicked on, so I can say they've been safe for me. So you can, yeah, I click on them, so Can't guarantee it for you, but they're absolutely fine for me. Now, one more thing before we leave the UK. Hospital-acquired infections. Now, we used to call these nosocomial infections. And this goes back to Hippocrates. He said the first do no harm. And then Florence Nightingale reinforced that, saying the hospital should do the patient no harm, as she brought about her reforms in Scutari, in the Crimea, that are famous in the UK. Strange the way Crimea is back in the news in recent years as well. So the hospital must do no harm. Florence Nightingale said that. If Florence Nightingale said it, it's good enough for me. She was a genius. Now, nosocomial hospital-acquired infections. So anytime someone goes into hospital healthy, gets an infection in hospital, we've done harm. We've done harm. We've broken the prime directive of healthcare if we do that. And what we've seen is 18% of patients in hospital with COVID-19 in England at the moment, as of now, beginning of October, caught it in hospital. So nearly 1 in 5 caught the infection, who have the infection, caught the infection in hospital. This is just breaks the prime directive of healthcare. Tested positive for the first time 7 days or more after admission. Okay, some of them could have a long incubation period, it's quite possible, but we know the average incubation period is 6 days, so the vast majority of those caught it in hospital, and this is not good enough. Now, I'm not necessarily blaming the staff for this. You go into our modern hospital, for example, here in Carlisle where I live, and you can hardly open any of the windows, and the windows you can open are in the little tiny ones. You don't get a proper breeze through them. And ventilation is everything in this. Ventilation is absolutely key. So when I was a student back in the long time ago, late 70s, early 80s, late 70s, 1980 in fact, we had these Nightingale wards, great big long wards. Some of you might remember them. They had tiles on the walls. They were built in Victorian times. They had often Victorian names. I mean, I had one called I worked in Princess Louise, for example, who of course is one of Queen Victoria's daughters, and they were absolutely brilliant. There was loads of space between beds. Once we'd done all the dusty procedures in the morning, we opened all the windows, and we got breeze going from one side of the ward to the other, completely changing the air out. What the Germans would call shock ventilation. Can't remember the German word. And then we'd have a cup of tea, and then after that, when everything had died down and the air was clean, then we would do the dressings. And we didn't get these hospital-acquired infections. Now we've got a huge foyer now that you walk into, and it looks really impressive, like walking into an airport, but then the wards are too small, you can't get your hoist in. It's all flipping hopeless. And, cross-infection is all but guaranteed due to hospital planners completely losing the plot. Florence Nightingale drew up plans of how to design hospitals, and we should still be following those designs today, and yet now that we know better these days, we get this massive amount of hospital-acquired infection. That's not a rant, that is what I consider to be objective facts. If you've got anything that contradicts that, do let me know. Okay, I'm going to leave that there now for the UK. I have got some notes prepared for the US and the rest of the world, so do come back if you'd like to watch that. But I have been getting told off for making my videos too long. Someone said John doesn't do short, and they might have a point. But I am working on it. I am hopeful of improving in the future. Thank you for watching, as always.